Good afternoon. I want to welcome you to our Thursday press briefing with updates on COVID-19. As of this morning, we have lost over 150 citizens in our community. Please join me in a moment of silence for the lives we have lost and for the families they have left behind. Thank you. Now we'll hear updates from our community leaders. First, we'll hear from the City of Albany Mayor, Mr. Doherty.
Thank you, Mr. McCoy. This will be our last press conference. You will, I expect, hear from representatives of the hospital who will confirm 3 days passed without a COVID patient being admitted. We do, however, know that the virus continues to spread in our community. I consulted the Department of Public Health website this morning. It provides an account of 1,845 citizens of Doherty County having tested positive. There have been 151 deaths, each the permanent loss of a parent, a sibling, a child, a spouse, a friend. We know that our neighbors throughout the region have also suffered. Calhoun, Early, Randolph, and Terrell counties all have a higher per capita rate of infection than here in Doherty County. I must admit that I have wavered on what I should say today. It is easy and appropriate to recognize and thank the courageous healthcare professionals, some of whom worked endless hours in the midst of scores of patients struggling for their lives. We must remember that these doctors and nurses and respiratory therapists and others willingly exposed themselves to protect not only their patients, but the entire community. It is likewise easy and appropriate to recognize and thank emergency medical technicians who entered homes where residents were ill or even in respiratory distress. These EMTs, for weeks, wore hazmat suits and were required to routinely clean the ambulances which transported patients to assure the next patient who required medical services in the field would not be unnecessarily exposed. It is easy and appropriate to recognize our police officers who continue to patrol our streets and firemen who throughout this ordeal remained on duty, prepared to respond at a moment's notice. I want to again thank the employees of our Public Works Department who continue to maintain our infrastructure and collect our garbage, and linemen with the utility board who assured no disruption in the delivery of electricity, gas, and water to our citizens. I should also recognize and thank our governor for the great investment of resources which were allocated to our community in the early days of our battle with the virus. There are legions of others who should also be recognized. National Guardsmen who we did not know, did not meet, and will probably never thank, were away from their families for weeks, spent at quarantine facilities and the collection site here in Albany. Critical care nurses, physicians, and respiratory therapists who came from other places to relieve employees of the hospital, exhausted. They were fully aware of the peril they would face. We should remember those who, within a matter of weeks, erected a medical facility on the grounds of Phoebe North, where most all of the COVID patients are now hospitalized. I would like to thank and recognize Dr. Ruiz and the staff at the Southwest District Office of the Department of Public Health. They have worked tirelessly, not only here in Doherty County, but throughout our region of the state, to contain the spread of the virus. I want to thank local businesses and our clergy for their cooperation and support. I was, frankly, moved when the chairman and I first spoke with leaders of our faith-based community I anticipated they would complain that their members needed consolation in this horrible time. Rather, ministers, priests, and the imam of one of our mosques sought direction from medical professionals. These men and women consistently notified Mr. Cohilas and I that they were praying for us and all those on the front line. Likewise, you may recall that many of our restaurant owners did not reopen, even though they were authorized to do so, due to concerns for the safety of their patrons and employees. In preparing my comments, I reviewed some of my previous statements. In March, when we announced the shelter-in-place ordinance, which, as you may recall, was 2 weeks before similar measures were taken by the governor, I assured you that Mr. Cohilas and I and your other elected officials were prepared to sacrifice and would sacrifice with you. That has been very true, as this has been a difficult time to serve. So, on a personal note, I want to thank those of you who have contacted me with kind expressions of encouragement and support. I also said that though we would be separated, we would not be divided. I believe we as a community have recovered and will overcome the devastation wrought by this virus because we confronted this disaster like those which have befallen before, together, united. Indeed, we successfully flattened the curve because the vast majority of our citizens followed the recommendations you have heard from this podium for the last 3 months. In closing, I can say that I have returned to the gym, though many of our older members have not. I'm very much looking forward to attending church this Sunday and sitting in the back pew where I've sat for almost 30 years. The service will be very different than the last service I attended. People will be wearing masks. There will be tape on the pews separating families, and there will be no congregational singing. Most of our restaurants have reopened, though there are fewer tables, and waiters and waitresses, cooks and cashiers all wear masks. All these changes are necessary, as we know the virus continues to spread in our community. So again, I implore you to continue to exercise the safety precautions you have heard time and time again. Maintain social distance, wear a mask when in public, and wash your hands thoroughly with soap and in hot water repeatedly throughout the day. I believe I can say we're winning, even though we have not yet won. God bless you.
Thank you, Mayor Durham. At this time, we will have an update from the Doherty County Chairman, Mr. Christopher Cohilas. Mr. Cohilas.
Thank you, Mr. McCoy. Thank you, Mayor. Today I'm very thankful, and I agree with much of what the Mayor has said. What we initially were dealing with in this community was unimaginable. We had super spreader events that were incredible, that spread it to thousands of people or hundreds of people very quickly. It gripped us immediately. It grabbed a hold of so many of our citizens, so many of our elderly, so many of our medically fragile, so many people that we loved and cared for, so many people within the judicial system, within law enforcement, within the medical field. We had so many people that it gripped at one time. It was absolutely unimaginable how we would move forward. And because we took swift and decisive action, because we have strong citizens, because we have community members that have been through 4 presidentially declared natural disasters, because we were able to ask for resources that other communities were not able to ask for or didn't even know how to ask for. We were able to access help so quickly, so strongly, that we were able to bring a lot of water to the fire that was burning at our feet. I'm very thankful for where we're at today, but I want to be very cautious in my words. As you heard from the mayor, currently this is the last scheduled press conference, and the reason for that is because we have stabilized. We have stabilized as many others around the state, many other communities around the state are now experiencing what is being called a second wave. Our first wave was bigger than 2 waves. That's how incredible the impact was of what we initially had. And I'm thankful to report how much we have been able to flatten the curve in such a short period of time. And I think that when people go back and look at what we've done here in Albany, Doherty County, a community of less than 100,000 people, and they look at the resources that we were able to access by collaborating, by working together, by communicating, by thinking outside of the box, I think it's going to be pretty incredible. Yesterday, I had the pleasure of being on our task force phone call, which at the very beginning of this entire process, we were conducting 7 days a week, sometimes 2-hour-long phone conferences between 20 to 25 professionals between city, county, healthcare, EMS, law enforcement, the mayor, myself, all sorts of very dedicated people dedicated to one cause. And I've watched as we've actually been able to ratchet back those phone conferences which preceded the press conferences and the actions that took place, the executive actions that the mayor and I took in order to declare a shelter in place before most other communities in the state even had heard of the term shelter in place. And I'm very thankful because now we're literally we've come to the point now where we can say, look, we don't need to have a press conference every day. We don't need to have a press conference 3 days a week. We don't need to have a press conference once a week. We're literally now at a place where we're stabilized. And yesterday in the phone conference that I had, I was very pleased to hear from Dr. Ruiz about comparing ourselves and the resources that we've been able to access here in this community as we move through this process. Per capita, Albany and Doherty County has tested more than anyone else in the entire state of Georgia. We have tested more than 4,000 per 100,000 citizens in this region alone. And that's not just Albany and Doherty County, that's us as an area, beyond just our county borders. The next highest in the state is at approximately 3,000 per 100,000. For a town of our size, that's absolutely incredible. I was also very pleased to hear how much we've flattened the curve in terms of the rate of infection, that we're literally at a rate of 73.4 per 100,000 citizens, whereas other areas of the state are experiencing a per capita rate of 1,025 per 100,000. 73.4 versus 1,025. And then cast your minds back to several months ago when I stood here and the mayor stood here and we literally were number 3 in the world behind the Wuhan province in China and the Lombardy region of Italy. It is incredible that we've been able to flatten the curve this fast, this strong, and it's because we have strong citizens, smart citizens, we have wonderful healthcare workers, wonderful law enforcement officials, and frankly, we have a sense of community and community pride. And we were able to access resources. I'm very thankful for the tremendous resources, the sophisticated resources that we have been able to bring to bear here in this community, the National Guard teams that came in and that I met with at the COVID-19 surge facility, the fact that Phoebe was able to stand up a drive-through testing facility that most other communities around the state and frankly around the country weren't even capable of thinking of at the time. The fact that we were able to test people and actually we were able to advocate for the testing companies to be able to turn around their tests faster than they were originally so that we could get more real-time results. The fact that we actually have contact tracers here in this community and an electronic system that literally monitors people that have tested positive or who have been exposed to people so that they get texts every day letting them know or checking in on them, making sure that they're doing the things that they need to do to make sure that the virus doesn't spread unnecessarily. I remember several months ago, as we heard from the coroner, we were hearing about literally the number of deaths just mounting, and we were having discussions about the fact that we were literally going to have to bring in a mobile morgue to stack the dead bodies of the loved ones in our community in, because there was no more room at the inn for them. That is a phenomenal place where we've been. And the reason why we've been able to do it is because we've worked hard, we've accessed great resources. And I also want to be very cautious in what I say. Because while this is an emotional victory, but it's not a complete victory. There can be no complete victory until there is a vaccine or until there is some other termination of this horrible pandemic. And that's something over which, neither the mayor or myself nor any of the citizens in this community have any real control, absent them absolutely knowing or having access to some sort of vaccine. The reality is that we have a new reality. And we are going to have to continue to do the things that we have been doing. The fact of the matter is we still have medically fragile and elderly people in this community, people that have multiple comorbidities, people that have diabetes, hypertension, people that are still going to be vulnerable to the spread of this virus and vulnerable in a way that is lethal. And we have greatly slowed the rate of death. And we've only experienced, I believe, 2 more deaths since the last report. And any death is too many. But we have greatly improved a horrific situation. And we have to continue to do things smartly. I also want to say this. We also can't continue to shutter up in our homes completely, unless you're one of the people that is recommended to shelter in place. And people have to continue to make individual decisions. If you are medically fragile, if you are elderly, if you are a person with multiple comorbidities or major underlying health issues, then you need to make smart decisions on how you do or do not interact. For those of us that are healthy, we still need to make smart, strong decisions in how we interact with people. We need to wear a mask when we go to the grocery store. We need to wash our hands. We need to carry hand sanitizer with us. We don't need to cough on people. We need to do all of the things that our grandmothers taught us a million years ago, which is, don't sneeze on people, wash your hands, use good sanitation. And now, in this iteration of life, we need to continue to wear masks. We need to continue to social distance. And obviously, many of the regulations have been relaxed, and our economy is starting to reopen, and that is a fantastic thing. And I'm going to say this. I have enjoyed going out into restaurants and been phenomenally impressed with the level of care that has been provided by our local businesses in leading how a community should respond. And I continue to say this, and I will continue to say this. We cannot continue to shutter ourselves in fear. Because when you do that, you literally encourage more harm, more pain, and more death from other reasons. And I've said this before, and I'm going to say this again. The cure to this illness cannot be worse than the illness itself. And we saw this, and we've seen this across the country. You have many, many people that aren't getting the medical treatment that they absolutely need and that prevents deaths. I've heard that the numbers on the overall diagnoses of cancer has gone way down because people aren't going in and getting those visits. It is time for us to return back to a quasi-normal way of life, using precautions, if you feel comfortable, going back out and doing the things that we need to do in order to care for ourselves, to care for our families, to care for our jobs, to be able to provide for our families, because shuddering in fear is not sustainable. And also, I think it's very important that we understand and that we carry the message that Albany and Doherty County doesn't have the Black Plague. We were attacked and gripped by a horrific amount of COVID-19 in a way that was frankly unimaginable. And but for the fact that we had the tremendous resources, the people, the executives, the healthcare workers, and the infrastructure that frankly flows from being through 4 presidentially declared natural disasters and that experience. But for that fact, it could have completely overrun us, and frankly would have overrun many other communities. But we're very thankful to have those resources that we were able to draw upon in fighting this. As we move forward, I want everyone to please continue to do the things that are smart. Keep in the back of your mind the things that you need to do. Keep in the back of your mind the things that got us here. And I'm thankful that this is our last regularly scheduled press conference, because it means that just like, and as the mayor said, I agree with what he said, we've sacrificed along with you. We've spent time away from our families, away from our jobs, spent time on phone conferences after phone conferences, meetings, discussions, late night discussions, in order to try and get resources here. And because as you have suffered, we have suffered, I'm also thankful that as I'm returning back to work, many of you are returning back to work and being able to do the things that actually earn money for your families so that you can put food on the table and provide that sense of community within your home. Thank you.
Thank you, Chairman. At this time, we will hear from our Phoebe Memorial Hospital representative, Dr. Black, Medical Director for Emergency Medicine.
Good afternoon. As we're over 100 days into this, something that we could never imagine, it doesn't get past us the tremendous strides we have made. And I think people have quoted, and over the past weekend, I guess Friday, Saturday, Sunday, we had 0 admissions for COVID-19. Since that time, Monday, Tuesday, and Wednesday, we have had admissions. But hear me clearly, we have had patients with COVID. They just weren't ill enough to require admission to the hospital. So the disease, the virus is still in our community. But we have done good things over the past 3 months and continue to do those things to help us beat back this virus. So I want us to continue in that mindset. Be mindful of the fact that a lot of our surrounding communities are experiencing tremendous surges, much like we saw several months ago. We're not out of the woods. Be mindful that Florida, their rate keeps going up. There are over 2,000 new cases a day. So as we enjoy the weather outside and have thoughts of traveling, be mindful that this is not over. So I want us to continue to do the things that have put us in good stead. You see up on our chart, those days we see no bar graphs. We did have a couple of good days there with no admissions, and the numbers overall have improved. We still have 30-something odd patients, and about a third of those are in the ICU. So again, we're not through this yet. We're still keeping those precautions. We're in a very deliberate manner opening back up the hospital on a limited basis to visitors. We are back fully functioning with some of the services that we had put on hold during the height of the COVID pandemic, but we are certainly not any less concerned, and we are very aware that it's a very tenuous situation, and with a couple of wrong choices or unfortunate happenings, we could be right back where we were a short time ago. One of the other hats I wear, or I have the pleasure of teaching hospital preparedness and disaster medicine on a national scale, and I've been on a series of phone calls and meetings and webinars, and you would be, maybe you wouldn't be surprised at the amount of attention that little Albany, Georgia has gotten. We have served as a model for the majority of the country and for places outside the walls of the United States. People have been paying attention and have been in awe of the way that we have been able to respond. As I've had the pleasure of teaching for over the past couple of decades, one of the things we always advocate is that any disaster, be it a natural disaster, be it one like we've had of an infectious nature, the response can be measured in how well the community comes together. And I think that we have, again, provided a model for people around the country in the way that the community leaders have blended with healthcare, blended with public health, blended with public safety, and it's been a multifaceted response and approach, and through that, we have managed to beat back, I didn't say defeat, but we've beaten back a terrible thing that none of us ever imagined. Again, I've been teaching this for the past 2 decades and never thought that I would ever see it. And we witnessed it firsthand, but what I've also witnessed is a tremendous response from the community. And that's the only way that we have been as successful we've been. So going forward, and although you won't see our smiling faces up here on a weekly basis, I want you to consider that a good thing. And I want you to consider that a testament to how well the community has responded. So we're going to continue to maintain our social distancing. We're going to continue to wear our masks. We're going to continue to avoid touching our face with our hands. We're going to continue to wash our hands frequently. We're going to continue to make good choices. And rest assured that our community leaders, when they feel the need, if they ever feel the need, we will come back together and say, hey, we have backslid. These are the things we need to do to continue moving forward. So I want to thank you for your help in helping us beat back coronavirus 19. Thank you.
Thank you, Dr. Black. At this time, we will hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Ruiz. Dr. Ruiz?
The last week of March is one that I want to forget, and I would imagine a lot of other people would too. That was a terrible week for Albany and Doherty County. During the last 7 days of March, between the 24th and the 30th, in Doherty County there were 480 new confirmed cases of COVID-19. But between June the 9th and June the 15th, there were only 12 new cases throughout Doherty County. Between March the 24th and March the 30th, there were 18 deaths, and between June the 9th and June the 15th, there was 1 death. We have been through some terrible times, and I agree with what has been said already today, that we have fared as well as we have in part due to the cooperation throughout the community. And I would also like to offer my thanks to the citizens of Doherty and surrounding areas for their overwhelming cooperation. Most people have followed the advice that comes through public health, Phoebe Putney and other organizations. And it has been with some sacrifice and some discipline that this has occurred. And by cooperating, citizens have made a major contribution in helping us to control this virus to the point that we have. I'd like to thank healthcare workers inside of public health and outside of public health, people who have served sacrificially, people who have worked long hours, people who have known that they themselves might get sick by serving others, yet they worked anyway. During their hours of work, they used personal protection equipment, not only to protect themselves, but to protect those that they served. And by using it appropriately, it has again helped us to limit the transmission of this virus. It has saved lives. I'm grateful to the families of people who reside in long-term care facilities because they have gone months now with limited visitation, if any, and that's a hard thing to do. Yet by cooperating and by sacrificing, they have, again, reduced the transmission and they have saved lives. And there are many others who have made a contribution who we don't have time to thank today, but it has been a great effort by many in the community. When this all began during the first and second week of March, none of us really had any way of knowing how bad it was going to be. For some reason, I was more optimistic than normal, and I remember saying on several occasions that we're going to get through this and we're going to be stronger when we get to the other side. I attended several community meetings and several meetings within public health, and as I would say that, I believed it, and I think that it was encouraging to those who heard it originally. But as the days went on, people began to doubt what I was saying. And as more days went on, I started to doubt it myself, and eventually I stopped saying it. But here we are on the other side of the hilltop. And looking back, we can see how people work together with teamwork and with selflessness, people who put aside their differences and pulled in the same direction. And as a result, this community has had a great deal of harmony, while communities around us and while communities across the nation have struggled with division. While we have some of those problems here, we have learned to work together through this tragedy, and I still believe that this community will be stronger, and I think we are already stronger as a result of working together with compassion for everyone concerned. Yet, the pandemic is not over. We are not to a point yet where we can let our guard down. The victory is not complete. There's more work to be done, and we still need to be diligent. There's some very important things to remember. We've said them before. Most of them are fairly simple and way near the top of the list, if not at the top of the list. We need to remember, if you are sick, you need to stay home until you have been medically cleared to go to work and to be around other people. I say that because I know many circumstances where we have had outbreaks throughout the Southwest Georgia Health District, and we can trace it back many times to individuals who knew that they were symptomatic with a fever or a cough or other respiratory symptoms, yet they did not heed the advice. They left their homes. They spread their germs around the community. So please, if you are sick, make sure you have medical clearance before you leave your home. Keep your mask handy, and when you cannot distance yourself from other people, please wear your mask. Remember to practice hygiene. Wash your hands frequently. If soap and water is not handy, be sure and use alcohol-containing gels and rubs. The Department of Public Health will continue to serve the community in a variety of ways. One way that we have served and that we will continue is through collections of specimens that will be tested for COVID-19 virus. I'd like to talk about some of the opportunities that are available, but first I want to say that for the foreseeable future, in fact, until December, the Department of Public Health plans to continue to provide the collections for testing throughout the state of Georgia. And that's certainly true here in Southwest Georgia, where we have 9 locations where people can go for collections on a routine basis. From time to time, we have special locations when we become aware of groups of people or communities where it's difficult to get tested. We do our best to go out into those communities and improve the access to the service. So we have several of those that I'd like to talk about that are special. This afternoon, in fact, as we speak, collections are in progress at the depot in Pelham, Georgia. Appointments are encouraged, and that can be accomplished by calling 229-352-6567 and schedule an appointment. They're not necessary. You can go without an appointment if need be. In Pelham, Georgia, this afternoon. This Saturday, the Meigs City Hall, collections will be going on. Next Tuesday, in Metcalfe, Georgia, in Thomas County at Mary's Kitchen, collections will be taking place. And then next Thursday, a week from today, again, back at the depot in Pelham. For our routine collections, though, the number is the same, 229-352-6567 to schedule an appointment. Collections take place on a regular basis in 9 counties: Colquitt County, Decatur, Doherty, Grady, Lee, Mitchell, Terrell, Thomas, and Worth. The schedules vary depending on the COVID-19 activity in those communities, depending on the demand for testing, and several other factors. But the key there is, if you'll call that number, you can discuss with the operator and select the location that best fits your needs. Operators are available Monday through Saturday. And again, the number is 229-352-6567. In addition to testing, another very important thing that public health does for the community is we are involved in epidemiology activities. And what that kind of boils down to is investigation of all cases, doing contact tracing, and monitoring the contacts. So we study each and every single case. We try to find out all we can about the individual. We make phone calls to these individuals or either talk to them in person. And for that reason, it's very important to answer your phone these days because it could be public health calling. Once we make a contact with the person who has the COVID-19 virus, it's very important that we extract a list of people who have been in close contact with that individual. So we ask your cooperation with that. That information will be protected absolutely as much as possible. And the only reason we ask for that information is so we can reach out to those individuals who are in danger to educate them. Once we do find out who's been exposed, we will educate them on proper quarantining, and we will educate them on what they should do as far as watching out for symptoms that might indicate that they now have COVID. I'd like to say also that people who are close contacts absolutely need to be tested for COVID-19. This is a little bit different from the guidance that we had a month or so ago. And then we actively monitor people who have who are on quarantine every day. We have contact with those folks throughout the duration of quarantine, which lasts up to 14 days after their most recent contact with the individual that was sick. So public health has been involved. We will remain involved to do our part in the response to COVID-19. We appreciate the cooperation of all other agencies in the community that have worked alongside of us, and we appreciate every citizen who has done their part as well. Thank you.
Thank you, Dr. Ruiz. At this time, we will hear a judicial update from Judge Willie Lockett, Chief Judge of the Doherty Judicial Circuit. Judge?
Good afternoon, and thank you very much for this opportunity to come today to announce the partial reopening of our Judicial Center beginning on Monday, June 22nd. On March 30th, 2020, the judges of the Doherty Circuit determined that it was no longer safe for the courthouse to remain open to the general public. This was because there was a disturbing number of courthouse employees, judges, judicial assistants, secretaries, deputies, bailiffs, clerks, and jurors who had contracted the virus, tested positive, were quarantined or hospitalized or treated. And of course, we unfortunately lost one of our judges as a result of courthouse exposure. The courthouse has been closed to the general public since March 30th, 2020. Meanwhile, though, many of our employees continue to telework, and the courts have been addressing the essential and non-essential civil and criminal matters through a number of techniques, whether they be telephone conferencing, televideo conferencing, in courtrooms at the jail, or by special appointment. I shared with our Commissioner a few minutes ago that our judges in some cases actually met people at the front door and stepped outside the courthouse to sign papers or to administer oaths and to continue the process going. May the 11th, Chief Justice Harold Melton of the Supreme Court of Georgia authorized all of the courts to resume conducting in-person judicial proceedings with a proviso that they must develop specific detailed guidelines that comply with the best practices and recommendations of the Georgia Department of Public Health, the CDC, and in accordance with the Georgia Court Reopening Guide, which was used as a template for resuming in-court judicial proceedings. I'm happy to announce that all of the courts in the Doherty Circuit have adopted a set of guidelines for reopening our courts. While the courts will continue to use televideo and teleconferencing whenever possible, and other alternatives as may be available, we will be opening the courthouse on a partial basis. And the reason I say partial is because we're still under direction from our Georgia Supreme Court not to begin having jury trials or summoning jurors or conducting grand jury proceedings. We have adopted guidelines which you're very familiar with. They've been talked about, as you all know, over the course of the last several months as we've attempted to deal with the pandemic. We're now incorporating those guidelines into the procedures that will be followed in allowing persons to enter the courthouse. The guidelines we have adopted are as follows. Everyone has to wear a mask or facial covering before they enter and at all times while they are in the courthouse. Everyone must have their temperature checked before they enter the courthouse. Everyone must answer the standard COVID-19 pre-screening questions that you're all very familiar with. The security officers will ask them whether within the last 30 days they or someone in the same household with them or someone that they've been in close contact with has tested positive, been treated, had persistent cough, shortness of breath, fever, chills, muscle pain, respiratory illness, loss of appetite, taste, or smell, whether they've been quarantined or in isolation due to possible exposure to COVID-19, and of course, if they're over 65, whether they have any heart, lung, kidney, or liver disease, or diabetes, or some severe asthma, or some other condition that compromises their immune system. Anyone who has a temperature of 100.4 or higher, or that answers yes to any of the screening questions will not be allowed to enter into the courthouse at that time. Instead, the security officers will take their name, the address, telephone number, the court or office that they were there to visit, and provide that information to the court or office and explain why they were not allowed to enter into the courthouse. The officers will also instruct those individuals to immediately contact the court or office they were trying to visit, either to have their case or hearing continued or postponed and rescheduled, or to schedule an appointment for a later date. As far as employees are concerned, the department heads will require employees who have a temperature above 100.4 to indicate that they may have been exposed, to leave work immediately, to remain at home for a time, get tested, and or seek medical attention, if appropriate under the circumstances. Now, everyone who is summoned to appear in court will receive, along with their summons, a notice. And that notice will advise them that if they have any of the symptoms or have been possibly exposed to COVID-19, that they should contact the court and let the court know and ask the court to continue and reschedule their particular proceeding. And if there are special things that they have to do in order to accomplish that, such as providing a notarized statement or something of that sort, they will get those instructions. And the number to call will be listed on the summons that the individuals will receive. The security officers provided by the sheriff, whether they are deputies or civilian bailiffs, will enforce social distancing, at least 6 feet apart, both outside the entranceway to the courthouse, in the hallways, in the courtrooms, in the restrooms, in the elevators, and any areas within the courthouse property. Each courtroom, hearing room, or other place where visitors congregate will be marked clearly to ensure social distancing at all times. Court sessions will be staggered to limit the number of persons that are present at any given time to the number that the courtroom facility can accommodate while maintaining social distancing. Courtrooms and hearing rooms will be disinfected after each session and surfaces which are in common areas used by multiple persons, whether they're employees or visitors, and restrooms will be cleaned and sanitized frequently. Additional sanitizing stations will be made available throughout the courthouse for employees and visitors, as well as sanitizing supplies for employees, including wipes and sprays and what have you. Now, these are just some of the public health requirements that are contained in the new guidelines for reopening the courthouse. There are many, many others. We have guidelines concerning pre-testing and pre-screening inmates who are being transported back and forth from the jail to the courthouse and from their cells to courtrooms at the jail, along the same lines as persons attempting to enter into the courthouse. Those are all set out in the guidelines as well. I've just tried to highlight those particular parts of the guidelines that may be of particular interest to the general public who may have business that needs to be transacted at the courthouse. The judges recognize clearly that there is a need for the public to have access to the courts and to the courthouse. At the same time, we understand that the pandemic is not over. The guidelines that we have adopted are designed to reopen the courthouse in the safest possible manner, keeping in mind the best practices that have been recommended by the Department of Public Health, by the Centers for Disease Control, and that are set out in the template provided in the Georgia Court Reopening Guide. We're going to be watchful of how this works, and we certainly reserve the opportunity and the discretion to make revisions as we see necessary for the protection of the community. But we have tried to employ every known strategy to prevent the spread of the virus and protect the health and safety of all of our citizens, while at the same time not depriving them of an opportunity to have full access to the courts. We're asking the citizens to help us out in the following ways. When you get a summons to come to court, read the COVID-19 notice and contact the court right away if there's any possible exposure that you've had within the past 30 days to the COVID-19 virus. Ask the court what you need to do in order to get a continuance or to get your hearing or case rescheduled. Ask the court that summoned you if the matter can somehow be handled without you having to ever appear in court, such as by paying a fine or paying a fee or restitution, or by teleconference. Bring your court summons to court with you so that the security officers will know why you're there and can better and more quickly assist you. When you come to court, of course, wear your mask and practice social distancing during your entire visit. We ask individuals, please don't bring children or non-essential persons unless you absolutely have to. That will help us to limit the number of persons that are in the facility at any given time and help us to enforce social distancing. If you've not been summoned to court, but you have court business that you need to transact, such as getting a birth certificate, a death certificate, a gun permit, or a marriage license, or to get some papers signed by a judge or filed, don't just show up. While we're certainly happy to try and greet walk-ins, it's better to call in advance and get an appointment. As I said, people are working still on a rotating basis, and you need to know what the best time to come and transact your business will be. This will also help us limit the number of persons present in the courthouse at any given time and get you served a little bit faster. And finally, we ask the community, as it has been and as has been so eloquently described before, please be patient. Please understand why we're doing what we're doing. Understand that we can get through this, and we're going to, but we need to all work together in order to accomplish it. Thank you, and I'll remain for any questions anyone may have concerning the court partial reopening that begins on this coming Monday.
Thank you, Judge Lockett. At this time, we will hear from Doherty County Coroner Michael Fowler. Mr. Fowler.
Good afternoon. As the mayor and chairman have said, and different ones have said, we want to thank each and every one that have helped during this time of the pandemic and the time that you have served, because I know many of us have put many hours in. And I want to also thank the funeral directors. Many of them have worked with families going through this process. I want to keep the families in prayer that have lost family members. And most of all, I want to say, I want to thank God for all He have done, because with all the knowledge that we have in the medical profession and the leaders have, we still have to trust in God that He give us the knowledge and the wisdom how we combat this virus. I think we have come a long ways. So due to the fact this is the last meeting that we'll be having, I wanted to give you true numbers and accurate numbers, because many times people be asking me, do we have what the actual count? Is it true or not? Are they hiding numbers? Are they adding numbers to get more funds? Well, the numbers that I give you is true numbers. The only way it's not true that I haven't gotten information from the local hospitals. But most of them are true. These are the true numbers that we have. As of today, June the 18th, we have 151 death residents here in Doherty County. There have only been 2 deaths in the last 21 days. Only 2 deaths in the last 21 days. And that's great compared to where we started out. We mostly got a death from Piedmont Hospital, and that was in week 12. So these are the actual numbers. Since it's the last day, we're going back through it one more time. March the 15th was the day that we first started having our death. That particular week, we had 10 deaths. March the 22nd, we had 16 deaths. March the 29th, we had 27 deaths. Week 4, we had 26 deaths. Week 5, we had 27 deaths. Week 6, we had 7 deaths. You can see the numbers. Week 7, we had 13 deaths. Week 8, we had 5 deaths. Week 9, we had 8 deaths. Week 10, we had 6. You see the number dropping. Week 11, the 24th, we had 4 deaths. The 12th week, on the 31st, we had just 1 death. The first, we had 0. And the death that we got from Piedmont, that was a late entry, so that death went on that particular week. Week 13, June the 7th, we had 1 death last week. As of this week, we have 0 deaths. You can see the number declining, so it's getting better compared to what it was back in March the 15th, the first few weeks. I broke it down by months. The month of March, we had 38 deaths. The month of April, we had 86 deaths. The month of May, we had 25 deaths. And of June, we just only have 2 deaths. So you can see that we have done something right. I think by practicing social distance, wearing our masks, washing our hands, not touching our face, all that plays a very important part. A breakdown of that, we have 24 white females, we have 1 Latino male, we have 8 white males, we have 61 black females, and we have 57 black males. Those are the actual counts that we have here in Doherty County, residents here in Doherty County. Again, like I said, we just keep practicing what we've been taught and pray for the best, because we know God's still in charge. I want to say that I appreciate the time that you have been listening to my presentation, and I hope it's been very helpful to you. Thank you.
Thank you, Coroner Fowler. At this time, we'll open the floor for any questions. Yes, sir, Commissioner.
communities in my area, they are very reluctant to come and get tested. They feel that it could be spooky, it could be some type of man-made disease that is attacking minorities. And since we're in the process of doing that, and there's still a lot of these underlines that hit the minority community and the Hispanic communities that like diabetes, cancer, colon cancer, asthma, and other issues that where it's prevalent in the black community. So as a person of the medical field, would you continue to advise the community that we need to change our eating habits? Things that was true 100 years ago is devastating not to the black community.
I appreciate the question, and I'll try to answer it. There are a lot of factors that we're trying to determine as to why the African American community and others appear to be at higher risk and have a disproportionately high mortality rate when confronted with the coronavirus 19. And a lot has been mentioned about the healthcare disparities that we have known to be present for a long time, and so long that it's been accepted as true, and not much has been done, or we haven't made much progress in removing those healthcare disparities. So you touched on a lot of things that I like to talk about, and one of those is accessing healthcare. And I didn't say access to healthcare, but accessing healthcare. And in addition to the aforementioned healthcare disparities, a higher rate of hypertension, diabetes, obesity, and other comorbidities, there's also several cultural things, some being maybe even socioeconomic, like forward-facing jobs. We tend to have jobs that didn't afford us to the ability to stay home and work remotely, as some of our counterparts may have had the opportunity to. And then you look at living situations that maybe more of us in a home than we expect. But also culturally, I've had a lot of people that don't want to seek care because of fear. And I don't want to call it unrealistic or irrational, it's fear. And what we have to do is break down those barriers and remove those as barriers and let people know it's okay. And we've done what we can, and there's much more to be done, but to try to push out that accessibility to healthcare to underlying areas so that they don't necessarily have to come to the hospital or come to one of the clinics, but by setting up remote testing sites and so forth, making that available. So I absolutely would encourage people to get tested. It's the one way we can truly find out the scope of the disease and the scope of the rate of infection in our community. But also, we saw, especially early on, a lot of people were coming into the hospital sicker than they are now because they were delaying access to care because of fear of either finding out the truth or getting sick if they came to the hospital. So I think we've broken down some of that fear, and people actually coming in a little bit earlier and therefore able to go home. We were not admitting nearly as many, but we also seen our rate of death drop because people are getting access to healthcare quicker and getting treatment started earlier. So absolutely, there's a lot of work to be done to remove the barriers, remove the misconceptions about accessing healthcare, but also a lot of things to do from our end, from the healthcare community, in not letting those healthcare disparities that have been around for a long time, not allow them to persist. And as I stated earlier, when we look back on this, we're going to learn a lot. We're going to talk a lot about how we prepared, and I think we did a pretty good job preparing. I think we did a pretty good job of responding. But how do we change going forward? Again, the healthcare disparities has come to light again as a causative factor in the higher rate of mortality. What do we do to change that going forward? So I do appreciate the question. I hope I answered your question. Thank you.
Dr. Black gave a very good answer. I might like to chime in just a little bit. The federal government has asked that each state currently test at least 2% of the population for COVID-19 every month. And they have also asked us to gradually escalate that to the point that in December of this year that each state is testing 4% of the community for COVID-19. And that's not just from the Department of Public Health standpoint, but that's the entire community. So we want to try to ensure that testing is available to the entire community, and so we're going to look at ways that we can be available at different times and different locations, so that everyone will hopefully find it easy to get a test. Currently in the state of Georgia, we are probably somewhere close to 2.5% to 3% per month as it is. So we're not there yet, but between now and December, we hope to get there. I do believe that knowledge is power, and we do need to share that knowledge in every way that we can. One of the things that the Department of Public Health does is we have staff members who reach out to young folks, adolescents in particular, to help them understand about healthy lifestyles. And so in our schools and in every way possible, we need to share this knowledge about COVID-19. As time passes, we're going to learn more. We need to share that knowledge, and part of that knowledge is an understanding that in order to know how healthy a community is, we need to have testing. Also, it's important to remind each other about this concept of teamwork. There's a limit to what the healthcare community can do on its own for an individual. Likewise, there's a limit to what an individual can do on their own without the healthcare community. But together, we can apply best evidence, we can apply science, and we can advise individuals on what they can do and what they must do in order to maximize their health toward the best possible outcomes. So at some point, we have to realize that we all do have some ownership in our own health, whether it involves avoiding substance abuse or proper exercise or proper diet. It's teamwork, and we need to work together, and particularly when it comes to morbid obesity as it relates to a vulnerability to COVID-19. That seems clear that severe obesity predisposes people to bad outcomes, and so good diet, exercise will help in that endeavor. And then one final thing I'd like to say is this is a great time for advocacy. Leaders in the community, for instance, who have had the COVID-19 test. I've had it myself. So those of us who have an audience can stand up whenever we have a chance and urge the rest of the community to participate in these kind of activities that lead to better outcomes.
Thank you, Dr. Ruiz. Thank you, Dr. Black. This concludes today's press briefing. I want to remind the audience that today is indeed our last press briefing, unless conditions change. I want to also remind the community that the Doherty County government buildings will be open to the public beginning this Monday, June 22nd, from 8:30 a.m. to 5 p.m. We will require everyone entering the building to wear masks, so please be sure to bring your mask when entering all city and county government buildings. Remember, mask up Albany, mask up Doherty. Stay safe, and thank you.